Welcome to Children's Pedcast, a conversation about pediatrics with children's hospitals and clinics of Minnesota.
Hello and welcome to the show. I'm Jimmy Bellamy, the social media specialist at Children's Hospitals and Clinics of Minnesota. And as you heard in the open, this is Children's Pedcast, Episode 1. Congratulations for making it in on the ground floor. We will bring this to you every Monday on iTunes, Podbean, and just about anywhere else you can hear a podcast. This is a conversation about the health and wellness of kids. We want it to be just that, a conversation. We want it to be more than a TV or radio style interview. So feel free to interact with us and take us everywhere. We'll give you information and cover the issues and concerns pertaining to child health from before birth through adolescence. And we plan to do that by featuring guests made up of experts from Children's, as well as the Mother Baby Center, the Midwest Fetal Care Center, and patients and their families. Before we get into today's guest, let me tell you a little bit about us. Children's is made up of 2 hospitals in Minneapolis and St. Paul, Minnesota, as well as more than a dozen clinics in the Twin Cities metro area. You can find us with the rest of the world on Facebook. We're on Twitter at Children'sMN, and episodes, audio only of course, will be available on YouTube and Vimeo. You can check us out on our website at childrensmn.org. My guest today is Dr. Stefan Friedrichsdorf. He's the medical director of the Department of Pain, Palliative, and Integrative Medicine. And he and his team this month celebrated the grand opening of the Kiran, Stordalen, and Horst Rechelbacher Pediatric Pain, Palliative, and Integrative Medicine Clinic on our Minneapolis campus. And it is a beautiful 10,000 square foot space that has a very Minnesota feel to it, complete with the sights and sounds of the North Woods and the North Shore. It's a pretty impressive place, and Dr. Friedrichsdorf and his team care for kids suffering from acute to chronic pain, and you'll get to hear all about that, as well as how Dr. Friedrichsdorf hopes that this is really the future of healthcare. And you'll even get to know a little bit about the doctor himself. It's an exciting time to be at Children's, and we're happy to be able to bring you this podcast. So sit back and enjoy this show. Thanks. So we had the pain clinic, the new pain clinic open up, the Kiran, Stordalen, and Horst Rechelbacher Pediatric Pain, Palliative, and Integrative Medicine Clinic at Children's Hospitals and Clinics of Minnesota's Minneapolis campus. That's a mouthful.
That is a mouthful. Jimmy, this is actually something which has never been built anywhere in North America. This is a unique, amazing, healing environment space. So 2 or 3 years ago, when Horst Rechelbacher and myself met, we started talking about this amazing idea of something which has never been done. Because, of course, Children's is an amazing institution, and we have space which is fabulous and addresses the needs of children. We were thinking, what is the next step? How can we actually get even further in the 21st century in healthcare? How can we even get more nature, more sounds, more lightning to the kids? And what you see when you look around is exactly this. So you see this amazing space where we use natural lighting. We do not have any fluorescent light. You hear some nature sounds. You hear some loons once in a while. It's a lot of material made out of nature. Wood. We have some board stuff. We actually have material made out of oyster shells and walnuts made to make sure that we're using as much material, as much natural material as added as possible.
What kind of effort took place in figuring out the layout and the design? Did a group of people have a say? Did architects come and say, here's what we're thinking, and then you and other people sign off on it? How did that go?
Once the idea was born, we needed to find some space, and we found this about 10,000 square foot right within the Children's Hospital here in Minneapolis, and so it needed to be shelled. And then we sat down with a group of architects, and Paul Udris from U&B Architect Design already worked with many projects with Horst Rechelbacher and his wife Kiran Stordalen in several projects, and they had a very good idea about what a healing environment could be. However, they've never been involved in managing anything inside a hospital. And hospital care usually is quite different. There are many rules to follow. So it was a very interesting project with our own very supportive people from leadership, from our own organization and design center, to architects, to the team, and coming up with an idea, how can we possibly make this as groovy as possible?
So what would you say to the parent or the person who isn't familiar with what a pain and palliative care clinic does, in addition to integrative medicine being used? What would be the 101 breakdown of it?
So we have 3 major programs under one roof, but they connect quite a lot. We're the pain medicine service, we're the palliative care service, and we're the integrative medicine service. Pain is pretty straightforward. We want to take pain away. There's nothing worse for a child to be in pain. There's nothing worse for a parent to actually see your own child being in pain. So what we do within the hospital and in our clinic is to make sure that we can follow the children's comfort promise, that we can actually prevent and treat pain as much as possible. This might be pain caused by surgery, open heart surgery and appendectomy. This might be pain caused by needles. This may be pain caused by headaches or migraines or functional abdominal pain or something called a complex regional pain syndrome. So there are many conditions out there of children who are in pain. In fact, more than 8 million children have missed school in the last school year just because of severe pain within the US. And there are only a handful of clinics like ours who are managing this.
When it comes to pain, as you've said, you see everyone from kids dealing with chronic pain, you deal with end-of-life care. How about if a kid is experiencing headaches or frequent migraines, what kind of help do you offer here?
In children with primary pain disorders, so the most common pain, as you mentioned, are headaches or migraines, musculoskeletal pain, fibromyalgia, joint pain, those tummy aches, the stomach pains, or what I already mentioned, the complex regional pain syndrome. So those 4 things are very, very common, and they're very, very disruptive. What we found is actually that surprisingly medications usually are not very helpful and often even make things much worse. What we do, we're one of the very few, if not the only clinic in the United States, where actually the whole team sits in the same room at the same time with the child. So there may be a social worker and a family therapist. There may be a physical therapist. There will be a psychologist. There's a nurse practitioner. There's a pediatrician. And we all hear the story once, so the kid doesn't have to tell the story over and over again. And then we sit together and talk about the plan, and on that very day we'll actually offer a plan. And very often it needs 4 main approaches. Number 1 is to exercise. Many kids, because they have pain, become deconditioned and they drop out of sports and they're doing much less stuff. So we basically have to make sure that they're getting much more energetic, back to normal. And the trick is to pace, not too much, not too little. And because if they do too much exercise, they will be in too much pain. And if they do too little, they're deconditioned.
Is it hard to convince a kid that when they restore normalcy in their lives, that before the pain gets better, it may get worse? Is that a tough hurdle for those kids to get over at times?
It is. And it sort of makes sense because our brain is not stupid. If something hurts, don't do it. If putting your hand on a hot stove hurts, well, then don't put your hand on a hot stove. If walking bare feet on broken glass, well, then our brain tells us don't walk on broken glass. So pain is protecting us. Pain is usually a signal and a sign to ourselves, don't do that. In chronic pain, in these primary pain disorders, however, the pain has lost its warning signal. It is not telling us that something is broken, inflamed anymore. And in fact, what we have learned is that first we need to get back to normal, and then the pain gets better. Unfortunately, it's not the other way around. There's not a magic pill or some surgery which sort of takes the pain away, and then they come back to normal.
Give us some background on yourself. How did your career path start? Was pain and palliative care and integrative medicine a passion of yours from a young age, or did it come to you through school, through high school? Where did you pick up? I guess where did you start on your career path?
Well, let me finish the first question, and then I'll come.
That sounds good.
So, because you actually asked what are the kind of things we would children expect to do in order to get rid of the pain if they have chronic pain. And I said number 1 is exercise physical therapy. Number 2 is learning active integrative modalities such as deep breathing, self-hypnosis, biofeedback, progressive muscle relaxation to enable children to use those modalities to actually get better themselves every day. Number 3, many children who have been in pain for a long time develop more stress. And when they have more stress, they have more pain. And when they have more stress, mood goes down. They may become even more anxious. So we do have 2 full-time amazing pain psychologists who then can teach children how to use integrative non-pharmacological modalities and also looking into how mood and stress is connected to pain.
That reminds me, when it comes to the deep breathing, biofeedback, hypnosis, do you know or have an idea after seeing a patient which would best work for the individual patient, or do you have? I know hypnosis is a favorite of yours. Do you say, I want you to do hypnosis, or are you able to kind of cater it to the individual patient based on your experience with that patient?
As always, what we wouldn't want to do is to make sure that children have a choice. There's nothing worse for a child or teenager coming to a healthcare institution and have no choice. And so what we do is offering choice. So what I say is, I actually don't care which one of those active modalities you do, I need to do one. And then I walk them through, and very often when I talk to the kids, when I talk to the teenagers, they often are very interested in learning one or two other things. Oh, this sounds good, tell me more about this. And then we start with those. And if that works, then it might be self-hypnosis, or it might be biofeedback, or it might be deep breathing. But then we're just going to teach them more, and over time, each kid then will develop and will his or her own tools, and will find out what he or she likes best.
This space, we talked about it at the beginning. It's quite different from the previous place. What would you say stands out to you as the main difference, other than, of course, the size?
This is a space that's never been built like this before. When you come in this room, you take a deep breath and say, wow. The environment actually helps you to heal. We've learned from the adult world when the Princeton in upstate New York destroyed the old hospital and basically built a new one. They actually found that by just redesigning the patient rooms in a much smarter way, and make them much more likable, that the amount of pain medication given to those adult patients went down by 1/3. Clearly, the surrounding has a calming effect. Meaning, if you are in a busy, small, crampy room with fluorescent light and you're fairly stressed out, your headache is likely going to be much worse. If you're sitting on the beach right now with you feel the sand under your bottom and you look into the sunset, vanilla ice cream in your hand, and the dolphins are kissing each other, you likely don't even notice your headache. So distraction using environment is something which we found extremely helpful. So the unique piece about this space is that we use nature as much as possible. We have large nature pictures. We have natural lighting, which reflects the daily rhythm, meaning at noon, the light is much brighter than it is, for instance, at 5 o'clock in the evening. So that even who people in the inside of the clinic and don't have an access to a window can appreciate what time of the day is. We have nature sounds. We use natural material. We have rooms specifically designed for different children's needs, whether it's an infant, whether this is for children with mental impairment or advanced serious illnesses, whether this is for children with acute or chronic pain. So we can use different spaces, and each room looks different, so they're not all the same. But because even in our house at home, rooms don't look all the same or have the same lighting. They have different architecture, they have different spaces to make sure that children and their families have a much better idea of what it would be like to relax in a nice space.
Back to my question about where you got your start. Take me down that career path, whether it was something that you learned at a young age that you wanted to do, or it was something you picked up later on.
I will finish with the fourth thing for the chronic pain,
All
and
right.
then we go to this.
I just so badly want to know about you.
As I said, so we key in managing chronic pain in children is, number one, physical therapy. Number two, learning daily active integrative modalities. Number three, working with a pain therapist to connect mood and stress to pain. And number four, lastly, is to get back to normal life. And get back to normal life are usually 4 S's. Kids often drop out of sports exercise. We get them back to that. Sleep is often disrupted, so we reintroduce a normal sleep hygiene. Many kids actually have less of a social life, so helping them to get back to normal social life. And key is go back to normal school. Many kids miss an enormous amount of school, so we help them to get back to normal school. We actually have found that going back to school is usually much, much more effective than taking kids out of school and doing homeschooling or online schooling. And so we help them to get back to that. So now to answer your question. About 12 years ago, I was happily sailing in Sydney, Australia, when I did a fellowship training to become a specialist in pediatric pain medicine and palliative care. I started doing medical school in Germany, where I grew up. I did my pediatric residency, meaning for 5 years I worked in a large children's hospital in Germany at the University of Witten-Herdecke to become a pediatrician. And during this training, I found I really don't like to cause pain. I was poking all those babies. I was causing all those children to be in pain. And I was taking care of children with serious illnesses at end of life. And I just felt I wanted to learn so much more. I wanted to help rather than causing pain or discomfort. And at the time, this is more than 15, 20 years ago, there weren't very many training possibilities. So having the opportunity to go to Sydney, Australia, to the Westmead Children's Hospital to take this training was fairly unique. And the details are quite murky, but at the time, Susan Sensor, the medical director of our Department of Oncology and Hematology, and Tim Kalpert, who ran our integrative medicine program at the time, met me at a pain conference 2003 in Sydney, Australia. And apparently we sat down and chatted a little bit, and they told me about the opportunity here in Minneapolis and St. Paul. And at the time, I thought, what? I never heard about this place. I didn't know about the Twin Cities. And clearly coming to America wasn't really on my radar. But they were very persistent, and leadership sent me an airline ticket. And in 2004, I came and interviewed, and I thought, well, I have a look at this place, and found this amazing children's hospital, one of the leading hospitals in the United States. And even then, even 10 years ago, it was clear that leadership, that the hospital, that the people working here clearly have seen the light. They were far more advanced than pretty much any other hospital in the world in the area of pain medicine, of palliative care and integrative medicine. And so I talked to my girlfriend at the time, wife now, and I said, hey, I've got this gig in Minneapolis, St. Paul, what do you think? And she said, well, let's give it a try. And 10 years later, we're still here. I started in September 2005. So it's very close to my 10th anniversary and at this amazing hospital running this amazing program.
Well, congratulations on 10 years. That's quite a feat. Is it a tough cause to champion? Do you find yourself meeting resistance from people when it comes to integrative medicine and the care that you provide?
So coming back to your very first question, what's unique about us? Taking pain away, taking distressing symptoms away, clearly means that we have to use world-renowned strategies such as medications, such as interventions, such as rehabilitation, physical therapy. What's very unique about us is that we also use integrative medicine. every time we also use non-medicine strategies, because of course we have found that those reduce the amount of pain medication I would need. And the resistance among the team, there are always a few people who may not believe that this is working, or do feel that in their very busy daily life this is something they could not integrate. However, being in the pain and palliative care service, you're actually pretty popular. If you ask kids, what are you most afraid about coming to this hospital? It's the pain, it's the needle pokes. And somebody who's actually designated to take this away, you're usually pretty popular by the kids. You're quite well liked by the parents. You're very well liked by your colleagues. So it is actually a very thankful job to do. And one-on-one helping children to get better, but also helping services to establish guidelines and a step-by-step approach to make sure that kids have no pain or as little pain as possible.
Tell me a little more about your team. I like the approach that you take where everyone meets with the patient at once, because a lot of times the stereotype is I go to the hospital, not our hospital, but I'm an adult, I go to a hospital, and you get done telling the nurse everything you tell the nurse, and then the doctor comes in and you have to tell the doctor everything you just told the nurse. As the team meets, does everyone have varying opinions of what approach should be taken? Do you take a consensus, or is it you as the lead saying, here's what I think we're going to do, or here's what I think we should do, and we roll with it? How does that work when you're working with so many with the social worker, with the psychologist? How does that all operate together?
So our program is fairly unique. What we are doing is not reimbursed by health insurances, meaning the straightforward approach is, what can we do to prevent and treat pain in children? How can I look a parent in the eye who's going to lose a child because he or she has a very serious illness and he or she may die in a week or a month, in a year? The least what we have to do is I have to promise this family, I have to promise this parent, you can call us, we will be there for you, we will make sure that your child is not going to die suffering from pain or distressing symptoms. This kind of stuff is not well paid by health insurances. Children's of Minnesota loses money doing that. And a way to maximize reimbursement is, of course, if to see people all alone. We would make much more money if we would see the kids alone by a physician, alone by a nurse, alone by a social worker, alone by a psychologist. But we have found that these kids with chronic pain usually have seen 2, 3, 4, 5, 6 different doctors. They have been in many different hospitals. They have had many blood draws, MRIs, they had a multi-million-dollar workup. And it really is not working for them to tell the story 3, 4, 5 times anymore. And I'm certain that one key why we have such a high success rate, more than 85-90% of the children with chronic pain become pretty much pain-free in following through with our program, is because we actually talk to each other, and not by letter or by phone, we actually talk to each other. So to answer your question, what happens is we actually then, it's an interdisciplinary team, and it's not that one person trumps the other. So there's no hierarchy. I will add my medical opinion. The social worker has taken the family story, will get the background story from the family. The psychologist may tell us about the discussion about stress or mood, other interactions. So, and when we put everything together, then we say, for this particular family, this probably is the best approach. And it's a consensus model, so we basically discuss it and decide what will be the safest and most efficient way to help this child and this family to get better, which often means a lot of hard work.
That's true holistic care right there, too.
We do hope so, and this, we think, is the future of healthcare. As we're moving away from a fee-for-service model, where the more stuff I'm doing, the more money I make. to what can we actually do to maintain and improve the quality of life and the health of the child and the family. That this is the real approach, having an healing environment, having an interdisciplinary approach where people are actually talking to each other face to face to help those difficult families, to helping those families who have children with difficult pain or difficult diseases to get better.
I took a tour of the space last week, and there are a number of areas, number of rooms, a lot of meeting areas. You have a gym. One area that stands out to me, and probably to a lot of people, is the Snoozelen room. And for those who aren't familiar with what a Snoozelen room is, please explain.
A multi-sensory room, also called Snoozelen room, is something I grew up with in Germany, in Britain, in Australia during my training. And where I saw it the first time was inside a children's hospice. Outside the United States, a hospice is actually a house. It's a house to provide respite for children with serious life-limiting conditions. And there are more than 35, 36 of those hospice houses, those respite centers in the United Kingdom. We have 10 in Germany. There are 7 in Australia. There are only like 2 in the United States, so it's not very common here. So when we designed the space, we have a large number of children where even the most fabulous room is not safe, is not something where these particular children would enjoy to be in. These are children who have progressive diseases. Maybe they're blind. Maybe they have conditions where it is unsafe for them to walk around. They would just pull things off the table. So a Snoozelen room, it's an artificial Dutch word which basically means to relax and explore at the same time. A multi-sensory room is specifically designed for children of all ages and all conditions to have additional repertoire, an additional set of cards to actually use different senses to distract yourself and to feel better. So when you come into this room, you will notice that there are no corners. You will notice that things can rip off the table. There are no computer or cables or anything which could endanger them. And there are lots of lights. There are bubbles in there. There are little spaghetti filaments of light which children who have visual impairment, who may not see as well, could put very close to their eyes in order to see this light. We have sounds coming out of a beanbag chair. So children who don't hear very well might find this vibration from the music coming out of this beanbag chair very soothing. We have an interactive 3D or 2-dimensional, depending on the computer, game on the floor where children can play with leaves or with fish, and their movement with the hands can interact. If children are in wheelchairs and cannot move very well, we have tools we can give them inside the wheelchair, and they can use buttons to change colors or light or the noise or the sounds within this multi-sensory room. So I actually quite liked the Star Tribune article, which was this Monday, on the front page, and saying it was a little bit coming to this room like Starship Enterprise landed in a yoga studio. So I had to laugh when I was reading this, but that reporter got it right. It's very modern architecture in a very relaxing environment. And this is the first time this has been done inside a hospital in Minnesota.
I thought Jeremy Olson, the reporter, summed that up perfectly in his opening graph. I agreed with him after taking a tour of the space myself. I know there are hopes for some expansion here too. What kinds of things are you looking to incorporate into the space down the road?
Well, don't tell anyone, but of course there's an evil plan. And
I see you clicking your fingers together when you say that.
Having a little cat on my lap. Well, the evil plan is this is spectacular space, and as people are coming here, I think pretty much everyone agrees that this is clearly the future of healthcare. So I'm hoping that we, as new space within children's and within other hospitals in North America, are changing, that more and more implement healing environment. Don't get me wrong, the space at Children's in Minneapolis, St. Paul, and all our clinics already is pretty much state of the art. This is amazing space. Compared to many other children's hospitals, this is the best place you can go. The question is, how can we get from 93% to 100%? How can we even make it more amazing? How can we actually get it even more healing? And as we are thinking about designing other spaces outside this, how about connecting more nature, pictures, backlit photos, sounds into the existing space? So my hope is that more and more places like this within Children's of Minnesota, but also at other places, are going to look like this.
Have people approached you and asked for feedback on whether it be hopes of doing this at their hospitals, or people within here offering or hoping to get some insight from you as to, what could we do with this space? What could we do to, I guess from my experience, I've been here almost a year, and what makes this so great is it doesn't feel like a hospital. And I can say that walking through the hallways in St. Paul, when you see the lit up stars, you can push them and they make noises, and you hear frogs croaking, and it's just it's a non-hospital feel. And there are so many areas on both of our campuses that are like that. Do you have anybody asking you, what can we do to make this feel less hospital-y, whether it be at another children's hospital or just another hospital in general that serves adults?
Well, considering that we just had our opening on Thursday, right, and today is Wednesday, so 6 days ago, I had already 4 requests from 2 inside Children's and 2 outside to actually look at the space, and we talked about, I already spoke to one other architect, about how could this be incorporated. And I agree with you. This is walking around in our campuses in Minneapolis and St. Paul and out west and our centers already has embedded many of this healing environment. We already have art with an amazing collaboration with local artists and have a piece of art in every single room. We're using light at best as we can. And the question is, well, we just finished a $300 million revamp of the whole hospital. This is one of the most spectacular places in North America to go inside a children's hospital. The question is, as we are growing, as we build a new space, can we even make it groovier? Can we even make it more fantastic as it already is? And yes, I had these discussions, and we put this out on social media. Then lots of newspapers and television studios have covered this within the last few days. So I'm getting this. And again, I'm a pediatrician. I just had the idea and the vision. The people who put this in place was the support from the leadership, was the Paul Udris and his team from UNB Architects. It was our own facilities team who was able to make this happen. So it is really a large number of people who were involved as within my pain, palliative, and integrative medicine team, within the team of Children's, and the amazing support from philanthropy. Because as you know, this 3.1 million, which it actually cost to make this clinic, was entirely raised by visionary philanthropist here in the Twin Cities and in Minnesota.
That's a great point. Tell me more about Kiran and Horst and what they have meant to this clinic and their generosity.
Without the starting gift from Kiran, Stordalen, and Horst Rechelbacher, we would not be in the space, and we wouldn't have this discussion right now. So when I came 10 years ago, the Integrative Medicine Clinic, which at the time was designed under the leadership of Tim Culpert, and was groundbreaking. And even last year, we had people coming from the East and the West Coast, and they looked at this clinic compared to what other hospitals have on the East and the West Coast. This was still pretty darn good. This was amazing. We just had outgrown it. We had many more patients that we could see there, and after 12 years, there were certain features we felt we need to upgrade. And most importantly, we are at 3 different places. We all need to be in one space. So we actually sat down. I met Horst and his family about 3 years ago. And at the time, which he didn't tell me at the time, but he actually had just been diagnosed with cancer. And he clearly was a visionary who, thinking outside the box is probably not even the right term to describe Horst. If you knew Horst, you always had a very good dinner story. So he clearly was had ideas. He was thinking about what could be happening, and he was fascinated by this vision of changing the style of building and healing environment. And after we met for the very first time, he said, "Stefan, I'm going to help you to make this happen. I will do this." And he's stayed put. He kept this promise. We met many more times over the next 3 years. I met his wife, Kiran Stordalen, who has become an integral part of his program. Both his daughter Nicole and his son Peter were amazingly helpful and to move this on. So the team from the company was very helpful to make this happen. So without this gift of $1.5 million towards actually starting this, we wouldn't be here, because then it became real. Then we had the support from our own foundation under leadership of Teresa Pesch, our director and president of our foundation, and the whole amazing team. We would have not been able to actually raise this money and to make this true, to prove, yes, we can have something unique, amazing, spectacularly groovy inside a children's hospital like this. And this is the next step to providing best care to children and their families.
You've mentioned a few times that you hope this is the future of healthcare. Where do you see 5-10 years down the road this becoming? Is it going to be further expanded? Is it going to evolve from what it is, or is it just going to be in more places and in more disciplines?
It's an excellent question. My vision is that rather than having a clinic like this and the kids are coming to us, that we are coming to everyone else. So we want to enable all our amazingly busy services. We see 90,000 children in the emergency rooms every year in Minneapolis, St. Paul. It's one of the busiest EDs in the country. There are more than 170 children diagnosed with cancer, one of the busiest programs within the country. We are the biggest cardiovascular program in the upper Midwest. We have the best NICU in the country. And beyond, neonatal intensive care units. So, and there are many other programs which are just outstanding, who are providing amazing care. And I'm so proud as being part of this children's family who provides this amazing care. And many of the components which we are fostering and we are promoting using active integrative modalities already is implemented in many of the programs. Advancing pain management is already implemented in most programs. So it's basically something which sort of moves on. It's a train which is getting faster and faster. And I hope that the architecture, the style is something we're going to see more around. But I'm certain that now as we're rolling out the comfort promise throughout our whole institutions and all our clinics, that families now starting to notice the difference in our approach to make sure that we prevent and treat pain in every single child coming to Children's of Minnesota.
When a child is either too young or unable to convey that he or she is in pain, what can a parent do to help identify that, to know that something is wrong and the child needs to be brought in for care?
Again, the single most important thing is the face of your child. If you're wondering whether or not your child has pain, you look in his or her face. If she looks calm, then we're probably on the good side. If your child is frowning, grimacing, crying, then probably something is wrong. And as a new parent, I have 3 children. When you have your first baby, you always wonder, well, is it a wet diaper? Is my child hungry, or is it a broken bone? So clearly, this kind of help is where family, where grandparents come in, where friends coming in, say, yeah, this is normal. Yeah, my kids have woken up at 3 o'clock at night, in the middle of the night. I was wondering what's happening, and well, it was just them, and they grew out of that. So if in doubt, of course, you ask somebody around, and you seek medical care if you feel that something is wrong. What are we doing if children can't talk? We have pain scales where we actually observe how the face is changing, whether or not they're sleeping well, whether or not their arms and legs are shivering. And so we give them a pain number between 0, no pain, and 10, the worst pain possible. And then you look what's possibly going on. So, for instance, if we know that little boys who are circumcised, and mind you, cutting off a piece of your penis is actually quite painful. If they have been circumcised without appropriate pain management, and state-of-the-art is something what we call a penile block, which is local anesthetic, those boys who have been circumcised without pain medication, they actually scream much longer and much harder at the vaccination at 4 to 6 months than boys who have been circumcised with appropriate pain medication. So kids do remember, even when they're babies, they do remember months later something painful was happening. So we need to make sure that, especially for children who can't talk to us because they're too little or because they have challenges in their development, that we provide the bloody best pain management we can possibly offer within a 2015 state-of-the-art institution like Children's Hospitals and Clinics of Minnesota.
So like I said, I'm coming up on 1 year. You're coming up on 10 years. You've talked a little bit about how Children's has grown and evolved, but paint that picture for me of where you've seen it go in the past decade.
When I came here the first time to interview in 2004, it clearly already then was crystal clear that this is an institution which has seen the light, where the specialist is really just down the hall. And that is an amazing difference. In many institutions, it's quite difficult to get the specialist. It might be problematic to interact with the team. And most clinicians here are here every day. They take care of children 5 days, 6 days, 7 days a week. I hope they have enough vacation to reach out their batteries. And people should and must. But what's happening is the feeling at being at Children's is noticeable. You come to this place, and I have the privilege of being invited to speak at many, many children's hospitals within the United States and internationally. And the flair, this feeling of going around is something fairly unique, something you have at very few places. So already 10 years ago, this hospital had the largest palliative care program of its kind. It already had the largest integrative medicine program of kind. So there were already a large number of amazing people who had provided care for the children and teenagers here in the Twin Cities and beyond. My privilege was to work with these people and add on to this and combine this into a true, holistic, interdisciplinary pain, palliative, and integrative medicine program. And now we have 36 people working our program, which makes us the largest program of its kind in North America. And we're still overworked. It's still like, if I look into the eyes of my colleagues, we still are very busy and come too early and leave too late, take care of these children. So we clearly need to even grow further to provide all this care, and also make sure that every single time anyone at Children's put a hand on a child, that we're thinking about, have we done everything to prevent and treat pain?
Are there things that can be done, and this might be a silly question, for kids not dealing with chronic pain necessarily, are you able to, in your treatment, help them take preventative measures for the future? Are there things you can teach them to, a child comes in with a broken leg, you clearly would say, okay, don't break your leg next time. But are there things that you can teach kids that will maybe help either lessen or eliminate pain in the future?
All right, so I will tell you a secret, something we are going to make official in summer of 2015. But I'll give you a preview. What we did last year, we actually went with an iPad to every single patient we had on one day within the children's hospitals of Minneapolis and St. Paul and in the emergency rooms. And we asked those children and we asked those families, what was the pain experience within the last 24 hours within children's? We were pretty proud of what we're having. We have one of the largest, one of the grooviest programs of its kind, but we wanted to know what are the next steps. What do we have to do to become even better? And to no one's surprise, after we got the results, clearly, hands down, the worst pain children experience, the one pain kids are most afraid about are needle pokes. Are the pains at vaccinations? Are the pains when we draw blood? Are the pains when we put a needle into a child because we're suturing them because of lacerations, or we put in an intravenous access? Hands down. In fact, if I go to any children's hospital in the world, I go to the entrance and I will ask the next 100 children, what are you most afraid about coming in here? What will 100 people going to answer? It's the needle pokes. So we have started something nobody has done in the United States. We are now starting a system-wide, complete change of how we're dealing with needle pokes. And Children's is a very large institution. We have nearly 4,000 employees. We have 2 main campuses. We have more than 30 clinics affiliated with us. We're seeing more than 300,000 children every year in the emergency rooms, in the clinics, and in our inpatients. So this is a lot of work. So with our lean team, that's a quality improvement team, working with Donna Ewell and Christian Widener, to name just a few within this amazing team, we are now changing what we're doing system-wide. And so what are the 4 things one must do whether a child gets vaccinated or gets any lock draws, and to make sure that kids don't feel any pain, needle pain, or as little as possible? Number 1 is to numb the skin. You can actually buy over-the-counter 4% lidocaine cream. You can just go to any drugstore and buy this cream. It's fairly inexpensive, and you can put this on the skin of your child, of your baby, of your toddler, of your teenager, and it even works for myself. We have a few adults who were very reluctant to believe how well it's working, and they just tried it themselves within our institution recently. And if you put this cream on for about 30 minutes, it significantly decreases or even eliminates the pain caused by vaccination or by needle pokes. Number 2 is positioning. Until very recently, many hospitals in America actually held children down when they were vaccinated or when they got IV access. And if I ask a 4-year-old boy, would you like to be held down on a stretcher by 2 adults, or would you like to sit on mommy's lap? What is this 4-year-old going to answer?
I'm thinking mommy's lap.
I think you have done your research extremely well. Every single child on the planet is most likely going to answer yes on mommy's lap. Kids do not want to be held down, so stop holding children down. So we are now in 2015, we're going from unit to unit and slowly implementing the new positioning. Number 3, we have found that distraction is ever so helpful. So offering something like blowing bubbles or playing an app on a smartphone or on a tablet, using little spy me charts, reading a story has really helped to decrease pain. And number 4, for children who are younger than 1 year, we now always use sucrose, sugar water, And we have actually found that this sugar water significantly decreases the amount of pain caused by needles. So this is something, as I told you, it's a secret, because we're going to roll this out in summer once we were able to actually get to every single unit and train every member of our 4,000 plus staff to do this. But we already have implemented in more than half our units, and the results are astounding. What we hear from the parents, what we hear from the families who go, for instance, to our outpatient lab in Minneapolis and St. Paul, it's a difference like night and day. Kids do not come screaming at the parking lot anymore when they come because they have to have another lab draw. They actually come and they are pretty much pain-free and don't have anxiety.
That seems like a good way to combat, I think, what has been a lifelong stereotype or fear that of needles. I know many adults in my life who are not fans of needles. I guess I don't know anyone who's a particular fan of a needle, but it seems like this would be a good way to, I guess, not that you could bucket necessarily, but if you get kids from an early age understanding that this is a pleasant experience, or at least not a traumatic experience, I can imagine that would do wonders for a child's pain.
This is so true. 1 out of 4 Americans have needle phobia. They're afraid of needles. And what happens is if adults are needle phobic, they actually are so worried that they may forgo vaccination. They may forgo seeking medical care if they find a nod on strange parts of the body. They may not go to the doctor and seek this out because they're afraid that a needle is happening. So it has catastrophic events. People may become much more seriously ill because they forgo care. People die because they have not been vaccinated to measles or things like this. So meaning it really, we need to make sure that children do not become needle phobic when they're children, and by implementing the Children's Comfort Promise to treat and prevent pain whenever possible.
I noticed at the end of your bio, you have had a lot of jobs in your career. How have you had time to have so many jobs prior to your work as a doctor?
Well, at the time, I didn't know that I was going to become a doctor. So I finished school in Germany, and way back then, this is in the 1980s, there was still the Soviet Union. There was East Germany and West Germany. I grew up in West Germany. So all East and West Germans were drafted to the army. And at the time, if you didn't want to be drafted to the army, you had to do some sort of a civil service. So what I thought is, well, how about I become an EMT, a paramedic? That's something which is helpful in life. So if somebody has a heart attack, you at least know what to do. So for the next 2 years, I actually underwent the training to become a paramedic in EMT and thoroughly enjoyed it. I liked the action. I liked being in an ambulance. I liked being in a helicopter, going to car accidents and helping patients. And then I saw all those physicians working with me, and I thought, well, I could do that. So this is how I actually just started applying for medical school. And in order to finance medical school, I had to work. So throughout my 7 years of medical school, it's a bit longer in Germany, I actually did work in a hospital as an assistant nurse, as an EMT. I delivered newspapers. I worked as admittedly a very poor journalist writing for the local paper, and just kept myself busy and also make sure that I can actually finance my studies.
I think I saw actor on there too.
Well, again, this always stresses a little bit. I was actually a director of a children's theater group. So I had a group of 10-year-olds who I directed for 9 years until they turned 19, and we put one play on stage every year. So that was a lot of fun. And I myself played in a local theater group as well. But again, it took about 10 seconds of self-reflection, noticing that my skills of being an actor probably would not feed me or a family ever. So this doctor thing was a plan B, and has worked out so well.
I think you chose the right path then. Or we could be looking at Academy Award nominee coming up here if you had went that other direction.
Well, we have to wait. Don't hold your breath for that.
I do have to ask, Australia is on my list of places to see sometime in the near future. Tell me about Australia, favorite things about it. What initially brought you there? Were you there before you noticed the fellowship, or was the fellowship what brought you to Australia?
Both. So I'd been 3 or 4 times to Australia before that. As a medical student, I actually did quite a bit of internships in the United Kingdom. Spent 4 or 5 months in Britain. I spent 3 months in Canada, in Montreal and St. John's, Newfoundland. As a medical student, I went to the University of Arizona and went out to with the Indian Health Service to Navajo and Apache reservations to provide healthcare at the time. And I also spent 4 months in Sydney, Australia at the time, never knowing that I would come actually back to fellowship training. So I have been around there a few times. Australia is stunning. It's a huge country. It's about the same size than the continental United States, and with only about 25, 28 million people. So it has about the population of Canada. And everything is different. You look in the sky and you do not know any of the stars because all the stars are different because of the southern hemisphere. The water in your bathtub goes out the other way around. All the plants look different. You see animals around you've never seen before. Kangaroos, wallabies are like squirrels over here, so you can really see them. So it's a very different feeling. And of course, Australia is an immigration country like the United States, like Canada. So it's an amazing mix of people as well. But Minnesota is very nice. The Australians going there, it's still something very nice, laid back. The bus driver wishes you a good morning every day. Good day, mate. That's something you might hear every day. It's stunning how nice, how laid back, how fascinating this country, the people, the landscape is. So absolutely go. And there's so much to see from major cities like Sydney or Melbourne to the Red Centre to Kakadu National Park up in the north where Crocodile Dundee was filmed, to where the Great Barrier Reefs meets the rainforest up in the very north. It's just stunning.
Yeah, I'm hoping to make it there sometime soon. My wife and I are looking to take a honeymoon, and I don't know if Australia's in the cards right now, but we definitely want to go there at some point. You've been very generous with your time on our inaugural episode. We appreciate that. How can people get in touch with the clinic if they have a child who they think needs help with pain management, pain care? What's your recommendation as far as how do they get a hold of you?
Again, there are many colleagues here in the Twin Cities in Minnesota in the upper Midwest who already have implemented many, if not all, of those modalities. If you as a parent or as a colleague feel that it would be beneficial to get an opinion here at Children's, you basically just call the 612-813-7888. I repeat, 612-813-7888. This is our amazing clinic staff. And then they can send out the package. We ask families to fill in a few forms before we actually provide the appointment in order to find out who would be the best within our team to actually see this particular child or teenager. If children are admitted within Children's in Minneapolis or St. Paul, colleagues can just make a consult 24/7 through our electronic medical record system, and we would be able to see them. If you listen to this and you feel, wow, so this is one of the most stunning, amazing programs, and this is something which is not funded by healthcare. This is something we lose money on. This is something which can only be done because visionary philanthropists have helped donate us, and sometimes it was $5 and sometimes it was $50, and in the case of Kiran, Stordalen, Horst, Rechelbacher is $1.5 million. This is the kind of help everything counts. Please just connect us. Look at the children's website, and you will find our program and the foundation, who can then connect to us, and we can talk further.
As the social media specialist at Children's, I have to say you are one of the best, if not the best, on our staff at social media and Twitter. So I appreciate that. I hope more staff members take on Twitter and are active. You're at No Needless Pain. If people are interested in following, I follow you. But other than that, is there anything else you'd like to touch on before we call it a day?
Well, again, thank you for spending time and giving me the chance to tell everyone that this is a team approach. Although you're talking to me, we're actually a team of 35 people, of physicians, of nurse practitioners, of social workers, of nurses, of child life specialists, a chaplain, psychologists. We have research staff. We have people on the stage and behind the stage to actually make this happen. So it's a true pleasure to work with such an amazing interdisciplinary team. And it's a true pleasure, and I truly mean this, to walk within the walls of Children's every day and interact with visionary leadership and my colleagues from on the floor who are taking care of tens of thousands of children and helping them to get back to normal health.
Well, Dr. Stefan Friedrichsdorf, thank you very much again for your time, and everybody listening, thank you for that, and we'll see you next week.
Thank you.